Good afternoon, everybody, and welcome to today's webinar about transitioning into a career in healthcare. My name is Eric Hultgren, and today you'll learn important tips and tricks from our expert, Shana Lewis, as well as have the opportunity to talk to her with a Q&A after her presentation. Shana Lewis is the Vice President of Talent Acquisition and Workforce Programs for Trinity Health. Trinity Health is the second largest Catholic health system nationally, with locations in 22 states. Passionate about removing barriers and creating greater access, Ms. Lewis has served in leadership roles throughout the community and at the state and national level, most recently on Governor Whitmer's Workforce Development Board. Shana was named one of the 50 most influential women in West Michigan in 2016. She accepted the 2017 Pillar Award on behalf of Mercy Health for her work in the advancement of minorities and women. So, why healthcare? Why this week of National Week of the Nurse? Well, the reason we did it this week is because healthcare is one of the fastest growing areas in jobs and economy, and the demand has accelerated through a global pandemic, as you would expect. The New York Times analysis says healthcare jobs will grow 15%, which is much faster than it is for all other occupations, adding about 2.4 million new jobs over the next decade. 6 out of the 10 most in-demand jobs will be healthcare, and including nurse practitioners, medical assistants, and home healthcare aides. And a recent SAA update notes that the pandemic is driving a surge in the need for traveling nurses and respiratory therapy workers. While changes are ahead as the pandemic unwinds, regulations shift to accommodate these needs. Now, before we jump into the main event, wanted to tell you a little bit more about Advance and how you know us in your local markets. Advance's mission is to strengthen and empower the communities we serve. And here are some of the operating companies, as well as our major investments that you're probably familiar with. But we're also hyper-local, with 24 newspapers, 9 #1 news and information websites, and the 3rd largest online news organization nationally, accumulating over 700 awards for excellence in journalism that we do day in and day out. We have the #1 reach in every market we serve, and our publications have been in their given communities for over 175 years. And here are just some of the newspapers that you interact with every day and some of the names that you're most familiar with. Now, enough of me talking. Without further ado, I'd like to bring in our expert, Ms. Shana Lewis. The floor is yours, my friend.
Hi, thank you, Eric, and thank you, Advance Local, for the opportunity to share just my journey in healthcare, the demand in healthcare right now, and how you can leverage your virtual presence during this really important week and this time in our country. Healthcare is at the top focus of this nation. We are the industry that is helping to not only take care of our communities, but really kind of lead us out of this pandemic that we've been in. And we know that the workforce shortages are more relevant now than they've ever been. In our very short time together, I'll share a little bit about my journey, just so that you know that you don't have to start in healthcare to be in healthcare. A little bit about the market demand, echoing some of what Eric has already shared. And then I want to spend the most time on how to leverage your virtual presence as you transition your career. As Eric had mentioned, we'll focus a little bit on healthcare today, but I want to speak to all of you out there that may be considering other industries as well. How do you transition your career to match your purpose? So Trinity Health, we, as Eric had mentioned, we are in 22 states. We have a very diversified system. Over 100,000 colleagues. We represent communities from California to Maryland. We also do about 24,000 external hires every year, everything from physicians to administrative staff, human resources, etc. I want to share our mission today because it will tie a little bit into the message that I'll share around you finding your purpose. Our mission at Trinity Health is to serve together in the spirit of the gospel as a compassionate, transforming, and healing presence within our communities. And we know that that healing presence is more important today than it's ever been. In your market, you will notice some of these brands. I know that we are airing in several different markets where our hospital systems are at. So we welcome you to engage not only in the chat, but also you'll see a text box at the bottom. If you're interested in learning more about working for one of our ministries, please feel free to text us or to drop us a chat. We'd love to hear from you. So my journey in healthcare, and I'll just spend just a couple of seconds on this. It started in 2013, and I will share on the next slide when we get there. The market was quite a bit different. It was my first time in healthcare. I started as a regional director for one of our health systems, and fast forward to 2021, now have the privilege of being the vice president, leading in 3 states for talent acquisition and in 22 states for workforce programs. So you don't have to have deep roots in healthcare in order to be in healthcare and advance in healthcare. I will say this though, you are needed. Your skill set is needed. If you just look at this, this graph, when I started in 2013, the US jobs were they were less than they are today. We're over 1 million open jobs in healthcare alone today. So we are continuing to grow. And as Eric had said, we are one of the fastest growing healthcare or fastest growing sectors in terms of creating new jobs. And this next slide, Eric had mentioned some of these occupations on here. Again, looking at the fastest growing jobs throughout this year and into 2026, creating about 2.3 million new jobs between now and then. These are just some of them that are highlighted that we know we have to close the gap on. So starting anywhere, you can start in more of an entryway role as a home health aide, you know, medical assistants, technicians, nurse practitioners, physicians, and beyond. I do want to share on the next slide though, you don't just have to start as a nurse or a physician. There are several critical jobs in healthcare that support our patient care. Everything from administrative roles to human resources, information technology, medical assistance, and so on. Many of these careers that you see on here are opportunities for you to get into healthcare. They don't take a lot of education. Some of them only require certifications that are 6 to 12 weeks long. Healthcare right now is really embarking on apprenticeship programs. So if you don't have any healthcare experience at all and you're considering healthcare, consider looking into apprenticeship programs or work-based learning programs that will allow you to learn the occupation while you're also earning wages. So some of the challenges that organizations are facing today, and in particular in healthcare, but we're not a minority in this. Most organizations in varying sectors are facing a skills workforce shortage. There just isn't the skills that we need out there today. A diverse workforce with middle skill jobs, not just entry-level jobs. Shifting staffing and care models are huge right now in healthcare and really amongst other sectors. In this para-COVID phase that we're living in, a lot of organizations have looked at their staffing models. What do they need to do different? What types of roles are needed for now and in the future? The changing skill set and competencies. The supply is not meeting the demand fast enough. There's sometimes a disconnect between what our educational and training institutes are teaching and what employers really need now. And then clear pathways, career pathways. There's a lack of talent development strategies in a lot of organizations. And the good news is that many organizations, and healthcare in particularly, is really looking at how do we close that development gap. So again, speaking to those of you who are in healthcare, that want to make a transition into another type of role, and those of you who are not in healthcare that are considering healthcare, consider looking into short-term work-based learning programs or apprenticeship programs connect with your local healthcare system and talk through how do you get started in a job in healthcare and how do you transfer your skills to healthcare. And then the last slide, which I want to share a little bit of time on, is leveraging your virtual presence. We know now more than ever how important this is. We used to use our virtually for Facebook or Instagram or any of the other social sites, but now we're on Zoom calls and WebExes and other platforms that are really elevating our interest in the marketplace. So some of the best practices that I've learned is, the first thing is polish your virtual presence. It's really important how you show up virtually. Your profile picture on your social sites, the posts that you post. Be thoughtful about what you're posting, knowing that whatever we put out there is for the whole universe to see, no matter how private we think it is. Your virtual backgrounds are important. You can upload different virtual backgrounds, but make sure that if you're in a space where you're being looked at professionally, that you have a background that is professional. I know that prior to my virtual background that I'm in right now, I was sitting in my kitchen. Well, I didn't want you to see my kitchen, so I wanted to make sure that I uploaded something that looked professional. Know your skill set. Be able to articulate your skills and copy written documentation. Know what you bring to the table and what your contributions are. Know your purpose and communicate your brand through posts by sharing articles, commenting on articles. Really create a virtual brand for yourself. Organizations are looking for individuals that are passionate about their mission, values, and vision. Align your purpose with organizations that match that. Reach out to representatives in organizations. So LinkedIn and other platforms, if you're really interested in an organization, do a little bit of research on them. Reach out to a representative at that organization and be brief and brilliant in your communication. Don't pester them. Drop a line. Hey, I looked at your website. I'm really excited about your mission and values. If there's ever an opportunity for me to contribute my talents and interests to your organization, please keep me in mind. It can be as brief as that. Leverage your network. You have a network out there. Look and see who they're connected to. Are they connected to individuals that belong to organizations that you want to consider working for? And then ask them to do an e-introduction. So a handoff, so you have an actual person that you can talk with. The next one is my favorite, and I have really been able to build my career on this. Get in the middle of an opportunity that's disguised as a problem. Oftentimes, we want to run from, the messiness, and we realized that more than ever in the last year, there were individuals that were running towards, how do I get involved with everything that's going on through COVID and social justice and those kinds of things. And then there were others that were like, I don't know what to do and I don't want to be a part of it. My best advice to you as you're building your career and your brand and you're looking at transitioning to an organization, get in the middle of an opportunity. You're needed. Your skills are needed. Your passion is needed. And then lastly, be willing to start somewhere. Where you're at today in one organization, you may have to start somewhere entirely different in another organization. The important thing is that you land at an organization that aligns with your core values, their mission and their vision align with what you want your brand to be. So that means that you may have to start somewhere. But once you get there, you're able to then quickly, be able to navigate what's the next career opportunities and the career paths for you. And so I hope what I've shared with you today in this brief time has been very helpful. I am now going to open it up for any questions. Oh, my last slide. This is a great one. Be bold. Document a big vision for yourself and go for it. You won't know what you're searching for if you haven't been able to articulate it to yourself first. A ship is always safe at shore, but that is not what we're built for, especially in these times and especially in healthcare. Boldness is needed, leadership is needed, compassion and passion is needed. So I salute all of you who are on the call today that are searching for your next opportunity, and I wish you the best of luck.
Thanks, Shana. You got time for a couple questions?
I do. Thank you.
So a couple of questions that have come in. Number one is, you specifically, when you and your team are hiring, what are things that people can do to make themselves stand out in a resume if they haven't had they haven't found you on LinkedIn, they haven't contacted you on Instagram, if you don't know them, what's some things that you guys look for that make those resumes really stand out?
Yeah, so in the resumes, oftentimes the traditional resume is to just kind of list where you've worked, the length of time you've been there, and some responsibilities that you've had. I always say at the very top of your resume, lead with some accomplishments that you've had, whether they're in the workplace or whether they're community accomplishments. Try to align some of those accomplishments with the job that you're looking for. So for example, if you are looking to transition into an administrative role or a leadership role, lead with some of those accomplishments on your resume. It isn't so much where you've worked, it's what you've done. So lead with that first.
Okay, and then the next question, you sort of answered this in your journey, but not everyone is you, Shana. So the question is, if I don't have a healthcare background, how tough is it to get into this career path?
It depends on what role you're looking at. Obviously, clinical roles require clinical experience.
Sure.
But
Yes.
many of the roles that I listed in the earlier slide do not require experience. Administrative is always a good place to start. Some of our more entry-level roles are a good place to start. The other thing to consider is healthcare right now is looking at how do we create and build the workforce that we're looking for. So several healthcare organizations, and Trinity is leading in this space right now, developing workforce programs that pulls in individuals in our community that doesn't have any healthcare experience at all, and put them into types of work-based learning programs like apprenticeship programs. So if you're interested in a particular role and you don't have experience, then I would say reach out to someone in human resources or talent acquisition and say, are there opportunities for me to gain this experience in your organization? What's the best way to do that?
Sure. And so on that same note, are there skills that people should be thinking about if they don't have a background in healthcare, but those skills translate really well to the healthcare industry?
Yeah, so in healthcare, we really think about a team that cares for our patients. And so even if you're not directly caring for our patients, that team approach, having that team mindset, great time management, and leadership qualities. You don't have to be in a leadership role for an organization to want leadership qualities. How do you lead yourself? How do you help influence and lead others? So again, if you've been involved in any types of community events or committees or organizations where you've held some type of leadership role, or at least worked on a team where you've had to get projects done, make sure that's highlighted on your resume. Those are the types of things we're looking for. Skills can be taught, technology can be taught, but who you are and how you show up, that's up to you. And that's what we're looking for.
That is some awesome advice, Shana. Last question for you, and then I will let you get on with your day, is specific to the industry right this very second. What are the in-demand jobs that, let's say, don't necessarily touch doctors and nurse practitioners, that sort of thing? What are the ones that you guys are looking for specifically in the other half of healthcare?
Yeah, so beyond the nurses and the physicians, some of our in-demand jobs are surgical technologists, our sterile processing, medical assistants. Oh my goodness, when you think about walking into a physician's office, and those medical assistants really kind of carry you right into that visit with the physician, that's very much in high demand right now. There are also other roles that are in demand. Leadership roles are always in demand. We have a shortage of really solid, strong leaders with good business acumen. We have a shortage of diverse leaders in healthcare. So really beyond nurses and doctors, it's wide open. But again, some of the more focused areas that we have are around our medical assistants, sterile processing, surgical technologists. And those are programs, some of those programs you can get if you have no experience at all. You can jump into a program and within a year, you can be a medical assistant. We have a wonderful medical assistant apprenticeship program that we're launching across Trinity that will allow you to enter into a medical assistant apprenticeship program, learn and earn at the same time. You don't have to have experience.
Awesome. Shana Lewis, thank you so much for your time today. We will let you go, but thank you again for being with us today, and have a wonderful week.
It's been my pleasure. Thank you so much, and good luck, everyone.
Now, remember to visit our online job fair where you'll find companies currently hiring in your local markets. And on that job fair, you'll see, if you scroll down to the bottom, there's a job seeker resource. And then there's an area with great tips and information similar to what Shana was just saying about the job search. And if you need somebody to professionally update your resume, please follow the link for a promotional value from one of our partners, getinterviews.com. They've been helping folks with a professional resume and even managing your LinkedIn profile for years now. And they've offered a special price for everyone who is a job fair participant. And also on our job fairs, you'll find that in all of our markets, our partners at LeafGuard are hiring, and they are a great company to check out. So make sure you head there and check out your local job fair online to connect with them for some awesome opportunities for sales and marketing and installers. So if you fall in any of those categories, LeafGuard is a great place to start. And you'll find the past webinars there as well, and highlights on how to spruce up for that Zoom interview. Also, how to stand out in a crowd. All right, friends, I hope you are doing well wherever you currently are. Have a wonderful afternoon, and we will catch you next time. See ya.